My name is Miles Levine. I'm 22 years old. I was diagnosed with epilepsy when I was 5 or 6.
Piper was diagnosed at 6 months. The toll of epilepsy on families is endless.
Watching my mother and father deal with all the responsibilities that come from having me, even at 22 years old, no parent should ever have to carry that burden.
The entire vision of Peace, when we first started thinking about it a couple of years ago, was to assemble a team of providers that is really able to address the unmet needs of the child and the child's family. And a lot of those unmet needs really are in the area of social, emotional, and behavioral health. I feel it's our obligation to be addressing all of those unmet needs that really, when it comes down to it, plague patients and their families more than the seizures themselves. So much has happened in the last year at the Pediatric Epilepsy Center of Excellence. We've been very fortunate to increase the amount of time that we have for our educational liaison. We've also been able to increase the amount of time that we have with our child psychiatrist.
My hope with a psychiatrist and a mental health clinician is we can really prevent some of the scarring that my husband and I keep finding 9 years later between us.
The next step is to hire a therapist that has a marriage and family therapy background so that they can begin to address those social, emotional needs.
So much relational strain on the siblings, my husband and me.
We would like to bring in a child and family wellness specialist that could use techniques such as yoga, mindfulness, relaxed breathing that could complement the work done by the marriage and family therapist. There is intense anxiety in terms of when is the next seizure going to happen.
Peace is going to hands down stand out by offering this comprehensive care.
A specialist who is trained to deal with that particular experience is a completely different thing than going to a general physician and asking for help, because that specialist is the one who's going to be able to bring the tools to the table that may very well make the family's experience with epilepsy livable.
Teaching a patient and teaching the patient's family to learn how to live with epilepsy, I think, can be transforming. 99.9% of the person's life, they are not spent having a seizure, yet they're dealing with all of the other comorbidities and stigmas. We hope that this has a rippling effect across the country and people will look at what we've done here at UCSF as being true pioneers in this model of care. So hopefully the update that I've shared with you today gets you as excited as I have been to truly see this program take shape.
I can tell you from my heart, you're about to change lives and change families.
To all of you who have supported this effort, from the bottom of my heart, thank you.